Hi, everyone. As the coronavirus cases are rising steadily in the country, today's topic is on the important discussion of how the crisis and subsequent lockdowns and restrictions have affected maternal and women's health in the country. To discuss these issues here with us today, we have Dr. Aparna Hegde, urogynecologist and founder of Arman and Center for Urogynecology and Pelvic Health, who has worked extensively in enhancing the reduction in maternal mortality through using technology. Thank you so much for being here with us today, Doctor.
Thank you so much for having me here, Aditi.
So if you could give us a bit of information on how the lockdown has affected access to healthcare for pregnant women and women living in vulnerable areas like slums.
Yeah, so what's happening is that in hotspots like Mumbai and Delhi, because of the fact that most of the slum areas are actually the hotspots, right? I mean, if you look at Dharavi, if you look at Mankur, and all of these slum areas are the areas where you have significant rise in coronavirus cases. And unfortunately, these are the places where the underprivileged women who are pregnant do not get access to care. So hospitals nearby, the smaller hospitals are all closed. Many of the bigger hospitals have become COVID hospitals. So unfortunately, the places where they are registered may be closed. They have no idea where to go next. And even if they know where to go, the hospital is open. Unfortunately, they have no transportation access because transport out from those hotspots is very difficult. So in this case, what happens is that, with other conditions, which are, manageable, you can maybe talk to the doctor on the phone, or not really require immediate care. Unfortunately, pregnancy is a condition where you require timely, regular care. You need to get ultrasound done at the 20th week. You need to get blood tests done every month. If you have any high risk factor like hypertension or diabetes or any other high risk like that, you have to monitor monthly, if not weekly. And during the last trimester, it's very required that a woman visits a hospital almost weekly. When such requirements are there, when you do not have access, it's terrible, because anyways, these underprivileged women are, become a part of at-risk women with respect to maternal mortality. And so the crisis has really, worsened their situation. Not only that, these underprivileged women also do not have access to right nutrition. Even during normal times, the nutrition suffers. They have underweight issues and anemia issues. And then in the situation where daily wages are not available, their husbands may not have jobs, they may have lost their daily wages themselves. It's extremely difficult for them to get access to nutrition for themselves and their children. And so in that situation, their pregnancy again becomes higher risk. So these are some of the conditions that pregnant women in urban slums are facing because of the corona crisis.
Right. And you see so many hospitals have shut down or become containment zones because health workers have gotten infected. How has this affected the delivery of healthcare to women in these areas, with health workers having to check up on them, etc.?
Yes, so it's unfortunate that many of the hospitals which should be functioning have become containment zones. So what happens is that when suddenly a hospital has a doctor who becomes positive, or a nurse becomes positive, suddenly almost 20 people in the hospital in contact with them get quarantined. Suddenly in one day, you don't have staff working for you. So your staff of 30 may get half to, in a department may get half to 15. And then obviously the load falls on the other doctors and other nurses. And it's very difficult for these doctors and nurses actually reach the hospital. I know for a fact that in hospitals like Kama, where I'm an associate professor, many of the acting superintendent is actually staying in the hospital. He's been staying there since last whole month, has not gone home, because it's extremely difficult to come to the hospital. There's no public transportation, right? Unless you have your own vehicle, and and you also get stopped at multiple places. I know for a fact that in Kama Hospital, for example, the OPD is running, and the nurses have to come to work. And initial part of the lockdown, imagine if you're coming all the way from, Vashi or Virar in Mumbai, the outskirts of Mumbai, they had to take, change 3 different buses. It's very difficult to come until, some amount of transportation arrangement was done by the hospital. So, so they are really overworked, and the problem also is that we have to assume that there is community transmission. So unfortunately, any woman coming in, or any pregnant woman coming, or child coming in, is a suspect case of COVID, maybe asymptomatic. I mean, results have come out now recently that almost 80% of people infected in India would be asymptomatic. So every pregnant woman coming in, even in emergency, may be a suspect COVID case. Now, in other conditions where you can kind of take care and not really treat immediately, you might even wait for a day before giving treatment where the doctor needs to be close to the patient. Unfortunately, in pregnancy, if a woman comes in labor and needs emergency section, you can't wait to find out whether the patient is COVID positive. You have to treat the patient. And you have to do C-section. You have to intubate. So you can imagine the condition of the doctors working in these hospitals. And one more issue is that many hospitals are designated COVID hospitals. So now they are getting support from the government. There is money, funding coming in from non-profit, etc., to kind of form ICUs for PPs, etc. Unfortunately, non-COVID hospitals do not have that kind of support. But when they operate, and C-sections have to get done, they can't be postponed. Unfortunately, they don't have access to PPEs. So every time a doctor goes into the hospital and performs a C-section, it's like Russian roulette. You literally are exposing yourself to the fact that you might get positive the next day. So, I mean, we're all trying very hard now to actually raise funds to kind of get in PPEs, because every C-section should be done by doctors who are, donning a PPE. So that's the problem, in Mumbai, Delhi, and many other urban areas in India.
Right. You mentioned that pregnant women coming in require surgery at times, and surgery anyways could lead to infection. And with the added threat of the virus, you see reports of women and their newborn children testing positive for COVID. So have hospitals tried to create this segregation of pregnant women and COVID patients if they have the time to check if they're positive or not? Is there anything being done for the segregation?
Yes, so in hospitals where like Kama or Sion, etc., where patients come in, obviously there's a kind of screening that's done, a screening that is done of the symptoms to pick up those patients who may be COVID positive. And if they have any symptoms suggestive, they would be isolated from the other patients, so that you don't transmit to the other patients. And also doctors are aware that these patients, you have to take extra care. And so they are placed in isolation wards, even though they may not have tested positive as yet, because it takes some time for the results to come in. And doctors obviously take extra care. Unfortunately, as I said in the earlier answer, access to PPEs, access to N95 masks and respirators is limited. So we really have to ration them out, and unfortunately, that is the reason why you're hearing all these stories of doctors in different hospitals getting infected, right? And now for the patients themselves, I mean, they're COVID positive. The care that they need to take is like for any other COVID positive patient, social distancing, obviously coughing with protection into your elbow, ensuring that you wear a mask, and hand washing. This is the protection that even a pregnant woman needs to take, but even more than any other person, because pregnancy is a low immunity state.
Right. As you know, also there is a glaring lack of evidence of how COVID actually affects pregnant women. Even in the outbreak of Ebola, frontline workers were struggling because they didn't have the correct guidelines or information on how the disease affects women. So how do you navigate solutions and create a blueprint for maternal health when there is such a lack of evidence?
Yes, the lack of evidence is really difficult for doctors because they don't really know how to handle pregnant women. But we do have evidence from SARS and previous such epidemics. So we have an understanding that such infections are far worse in pregnant women because pregnancy is a naturally a low immunity state. So pregnant women, if they contract COVID, if we go by past evidence of epidemics, may have a more, their evolution of the condition in their bodies would be harsher than in other COVID positive patients. And that's why, if you look at most guidelines, pregnant women are included in the high risk category, along with diabetics and hypertensives and people with cardiovascular conditions, etc. So pregnant women need to be aware of the fact that they are high risk if they contract COVID. They need to take stringently all the precautions that have been spoken about how to prevent, getting affected by COVID. I mean, social distancing and all of those, different, rules you follow. So they have to be at home, do not go out. The lockdown is extremely important for pregnant women. Now, the thing is that a pregnant woman, when she has symptoms, so I'm getting these calls, I mean, I suddenly got a call from the manager of a salon that I used to go to, I just went once and he knew I'm a doctor. I got a call in saying that his wife has got upper respiratory tract infection symptoms. And they were like, it's only URTI, it's only a cold and cough. But I was trying to convince them that, look, a pregnant woman with even a slightest symptom, though it looks like a cough and cold, they have to go in immediately to get tested. So you should test early if you're a pregnant woman. Do not wait and to see if it, wears off on its own, expecting it to be a cough and common cold. So pregnant women have to go in for testing earlier. Now, during delivery, what evidence has come out is that you do not need to do C-section for COVID positive patients. You manage a COVID positive patient like any other pregnant patient delivering. However, you take extra precautions. So doctors there obviously have to wear a proper N95 mask, have to wear a shield, and ensure that they have, they keep themselves away from the patient as much as possible. So C-section should only be done if it's medically or indicated, but not for COVID. And while doing C-section, of course, the anesthetist and the doctors have to take extreme care. Now, there's evidence coming out of China that COVID does not actually transmit to the amniotic fluid. There's been evidence where they have tested the placental tissue and they haven't found COVID positivity in the placenta, though the mother was COVID positive. Also, there's some amount of evidence coming in that COVID does not get transmitted in blood in the breast milk. So that is good news. Yes, we have this evidence that some children have, some newborns have got affected. Maybe they didn't get affected through the womb. Maybe it was not transmission from the mother to the child. Maybe it was because the child was exposed to the mother after the child was born. Lastly, should the mother breastfeed the child? Of course, she should breastfeed the child, because there's evidence coming out that, breast milk, breastfeeding has more benefits. There are more pros to breastfeeding than not breastfeeding a child of a mother who's COVID positive. Just as in HIV positive mothers, we do tell them to breastfeed. So similarly, in COVID positive patients, they should breastfeed their children because the benefits of breastfeeding are immense. Obviously, taking all care.
That's great information to know, actually. As you know, a large part of the global health workers are women, and even in India, about 89% of nurses and midwives are women. Do you feel like this crisis has more of a negative impact on women?
Of course, because if you look at the health worker force in the country, every ASHA worker, every village in the country has an ASHA worker, and every ASHA worker is a woman. And these ASHA workers are on the front line of the COVID, crisis that we have. I mean, they are out there going to the villages, screening with their limited PPE, with limited protection. And I'm very worried for them because of the fact that they are don't have much knowledge. I mean, yes, now there's a whole effort to ensure that there is knowledge given to them on how to kind of take care of themselves and how to screen. But with limited PPE, they can't do much beyond take rudimentary care of themselves. So yes, they are at risk. And also, if you realize, the ASHA workers are the backbone of the health system, and so they not only have to do the regular work, they also have to take care of COVID screening. So they are at risk. Similarly, if you look at urban India nurses and the IMOSHs, they're all women, and mostly women, that is. And again, their access to PPEs is limited, and they are on the front line. So of course, we're very worried about these women and what they expose themselves to on our behalf. They truly are the unsung heroes.
Absolutely. We've been talking so much about the problems surrounding this crisis and the issues. I think the last question can be about a solution. I know you've been doing a lot of work on how to increase access to healthcare through technology. If you could elaborate a lot more on that.
Yes. So, I mean, we are going towards a new normal, literally. I mean, the fact that care, face-to-face care is going to become more and more difficult in the, I mean, it's already difficult, and it's going to be difficult going forward in the next few months or so, because COVID is going to come back in waves, and that's what the evidence states. So, and the hospital systems are already overworked. everybody is focused on COVID. And so regular care is suffering. And in pregnancy and childhood, regular care cannot wait. So what do? You have to have virtual solutions. So if you realize, Arman, my NGO leverages technology to create scalable solutions. So we already have 2 programs called Mitra and Kilkari. These are voice call services which send voice calls weekly to counsel women during pregnancy and infancy. It gives them knowledge about how to take care of themselves during that week, how to prepare for something important in the future, how to it reinforces very important information. During this time, where they don't have access to hospitals, where travel to hospitals is very difficult, where even if they reach a hospital and hospital is so focused on COVID positive patients, regular care is suffering. Our services that are virtual become even more important. And not only that, what we realized was, so if you look at Mitra service in Mumbai, we're covering the entire Mumbai city, and we realized that women in 3rd trimester did not even know, where to go, because their labor is approaching in 2 weeks' time, and they didn't know where to go. So they were calling in our hospital supervisors who are enrolling these women into Mitra. So we started a virtual OPD for them. In Mumbai, since last 2 weeks, we have been doing a virtual OPD with volunteer obstetricians and pediatricians, and it worked extremely well. So we would have women calling in, and our hospital supervisor would connect the doctors and ask those questions, and the women were guided. Because it ran so well, now we have actually taken the virtual OPD countrywide. So any woman in the country can call our toll-free number. I'll let you know the toll-free number later on. From 11 to 3 p.m. is the antenatal OPD, and 3 p.m. to 7 p.m. is the pediatric OPD. These are manned by very highly qualified obstetricians and gynecologists. So any woman with any query can call in the designated time and ask questions from the doctors. So our voice platform, so we have an extensive digital platform. So we are leveraging that to triage these calls to the respective doctors on the roster, and we are hoping that more and more women avail this service. And already in the last week, since we announced the nationwide call center, we've been getting 30 calls in 3 hours time. So we are hoping that we have a capacity to increase the calls to 1,000 per day. Hopefully women will avail of that service and access care, because when you're sitting at home under lockdown, no access to transportation, you do not know what is happening to you, you do not know where to go. It's good to reach out to a qualified person who can assure you whether the condition does not require immediate care, or if there's an emergency, can give you the right guidance of where to go and how to take care of yourself. So please do avail. I would like to tell your viewers to let people that the service exists and they can call in our helpline. So can I give you the number of the helpline?
Sure.
Yeah, so the number is 1800-212-1425. I repeat, 1800-212-1425. So pregnant women can call in between 11 a.m. to 3 p.m. and mothers can call for children from 3 p.m. to 7 p.m. And so we really look forward to helping you navigate this difficult time better.
Absolutely. Thank you so much for giving all this information and answering all our questions. And thank you for everything that you've been doing. I think it's because of health workers like you that we can even think of getting through this crisis. So thank you so much for being here with us today.
Thank you so much. It's a difficult time, but times like this bring the best in us out. And so all of us can work together to ensure that not only we help ourselves, but help the pregnant women mothers in this country to do better, because they are the backbone. If you look at public health, is maternal and child health, literally. And if mothers and children of the country do well during this time, the entire country will do well. So hopefully we can work
together. Thank you again.
Thank you. Thank you so much.